Welcome back. I'm Nurse Educator Chelsea, and today I'm going to be talking about multiple sclerosis. Multiple sclerosis is a degenerative disease of the central nervous system characterized by demyelinization of the neurons. It is a chronic and progressive disease. Symptoms usually begin between the ages of 20 and 50 and is characterized by periods of exacerbation and remission. Symptoms can include, but are not limited to, weakness, fatigue, ataxia, visual disturbances, vertigo, paresthesias, dysphagia, bladder and bowel dysfunction, abnormal reflexes, decreased perception of pain, touch, or temperature, memory problems, or confusion. Now, the cause of MS, or multiple sclerosis, is unknown, but it's thought to be an autoimmune response to a viral infection. While we don't know a cause, there are some groups of people that tend to have a higher incidence of multiple sclerosis. These can include individuals with a family history of multiple sclerosis, those that are Caucasian of Northern European descent. Women also tend to be 2 or 3 times more likely than men to develop MS. It is also thought that those with low levels of vitamin D or limited exposure to sunlight could be at risk for developing multiple sclerosis. Additionally, it's also thought that those with other autoimmune diseases, such as type 1 diabetes, thyroid disease, irritable bowel disease, psoriasis, or pernicious anemia could be at a higher risk for developing MS. Testing can include an MRI, lumbar puncture, blood tests for specific biomarkers. Another test that can be done is an evoked potential test, which records electrical signals produced by the nervous system in response to stimuli. MS can be difficult to diagnose in those individuals with unusual symptoms. At this time, there's no cure for MS, but there are treatments that can help speed recovery from exacerbations and help manage symptoms. Corticosteroids and muscle relaxants are often used to manage symptoms and to treat exacerbations. You will see on your screen now some other medications that can be used for multiple sclerosis. First, you will see a list of injections. Here you'll see some oral medications that can be used for multiple sclerosis. And lastly, here are some infusions that have been used for multiple sclerosis management. A plasma exchange can be done if symptoms are severe and have not responded to corticosteroids. Other treatments can include physical therapy and occupational therapy, stress management, which can include medications, deep breathing, meditation, or in some cases, therapy. It is also encouraged to get adequate sleep and rest, which can sometimes mean diagnosing and treating sleep disorders, and exercise, such as walking, stretching, low-impact aerobics, Tai Chi, yoga, or stationary bicycling. Nursing interventions for multiple sclerosis can include monitoring for complications, such as urinary tract infections, pressure injuries, or respiratory tract infections. Patients also need to be educated to avoid extreme temperatures, to eat a balanced diet, and to get adequate fluid intake. We should also educate about fall and injury prevention for those with impaired mobility. We can also provide local or online support group information for those that are newly diagnosed with multiple sclerosis or those struggling with their diagnosis. Thank you for coming to learn with me today. Please remember to rate, review, and subscribe to get the latest updates on my channel.